Weight gain is a common side effect of many mood stabilizers and antipsychotics. Lithium can cause tremors in some patients. Drowsiness and fatigue are frequent side effects of antipsychotic medications. Dry mouth is commonly reported with many bipolar medications. Cognitive dulling, often described as brain fog, can occur with mood stabilizers. Sexual dysfunction is a potential side effect, particularly with antidepressants. Antipsychotics can lead to metabolic syndrome, increasing the risk of diabetes. Lithium may cause kidney damage with long-term use. Thyroid issues such as hypothyroidism can result from lithium use. Nausea and gastrointestinal issues are common during medication adjustment. Some individuals report experiencing emotional numbness. Lamotrigine can cause a life-threatening rash, Stevens-Johnson syndrome. Antipsychotics can lead to tardive dyskinesia, a condition causing involuntary movements. Antidepressants may trigger manic episodes in bipolar patients. Sudden withdrawal can lead to severe rebound symptoms or relapse. Many medications require strict blood monitoring, like lithium levels. Akathisia, a feeling of inner restlessness, can occur with antipsychotics. Mood stabilizers can interact negatively with other medications. Antipsychotics often cause elevated cholesterol levels. Depakote has been linked to liver damage. Medications can cause significant hair thinning or loss. Insomnia or disrupted sleep patterns may occur with some treatments. Antidepressants can worsen rapid cycling in bipolar disorder. Many medications increase the risk of cardiovascular disease. Some drugs can cause lightheadedness or dizziness. Bipolar medications can lead to dependency in some cases. Antipsychotics can impair balance and coordination. Lithium toxicity is a risk if levels are not carefully managed. Medications may reduce creativity or emotional expressiveness. Certain drugs can lower seizure thresholds. Antipsychotics can cause hyperprolactinemia, leading to hormonal imbalances. Medications can suppress the immune system, making infections more likely. Patients often report reduced motivation or energy levels. Long-term use of antipsychotics has been linked to brain volume reduction. Sudden weight gain can lead to body image issues or eating disorders. Medications can disrupt menstrual cycles in women. Antipsychotics have been linked to a higher risk of stroke in older adults. Bipolar medications can worsen gastrointestinal reflux disease. Antipsychotics are associated with sedation and excessive sleep. Mood stabilizers can cause low sodium levels, hyponatremia, emotional and psychological impact. Some patients feel emotionally flat or disconnected. Medications may suppress both positive and negative emotions. Antidepressants can cause irritability or agitation. Many people report feeling over-medicated or zombie-like. Loss of libido can strain relationships. Patients may feel stigmatized for taking psychiatric medication. Fear of dependency can cause anxiety about long-term use. Many medications reduce the intensity of euphoric manic episodes. Some patients experience difficulty focusing or concentrating. Emotional numbness may lead to a sense of loss of self-identity. Medications can diminish feelings of spontaneity or joy. Many people report increased self-doubt due to cognitive side effects. Dependency on medication can feel disempowering. Adjusting to medication often takes months, prolonging emotional distress. Trial and error periods can lead to frustration and despair. Medications can reduce resilience to stress over time. The need for lifelong treatment may feel overwhelming. Side effects can worsen pre-existing mental health symptoms. Fear of side effects can lead to anxiety about medication adherence. Medications may impair a person's ability to trust their emotions. Antipsychotics can blunt feelings of ambition or drive. Some patients feel that medications inhibit their creativity. Emotional flatness may hinder meaningful personal connections. Antipsychotics can increase sensitivity to criticism or stress. Bipolar medications can alter emotional memories. Long-term medication use may create feelings of dependency. Emotional numbness can contribute to a lack of empathy. Medications can make people feel they are less themselves. Antidepressants may increase feelings of frustration. Medications can lead to a fear of losing control without them. Over-medication may exacerbate feelings of helplessness. Medications can diminish the ability to experience deep connections. Fear of relapse creates constant emotional vigilance. Antipsychotics can cause emotional hypersensitivity. Some people feel they lose their sense of humor or playfulness. Medications may make individuals less willing to take risks. Many people report reduced spontaneity or creativity. A lack of emotional highs can feel restrictive or unnatural. Patients often feel discouraged by the need to manage multiple medications. Medications can delay the process of emotional healing or growth. Long-term health risks. Chronic use of mood stabilizers may increase the risk of kidney failure. Prolonged use of antipsychotics is linked to osteoporosis and bone density loss. Lithium can lead to hyperparathyroidism, causing calcium imbalances. Some medications increase the risk of developing heart arrhythmias. Long-term antipsychotic use has been associated with brain volume shrinkage. Prolonged medication use can result in permanent nerve damage. Mood stabilizers can disrupt long-term blood pressure regulation. Some drugs contribute to chronic liver inflammation. Medications like Depakote may cause polycystic ovary syndrome in women. Antipsychotics have been linked to increased mortality in elderly patients. Long-term sedative use may impair sleep architecture, worsening sleep quality. Certain medications elevate the risk of blood clots or thrombosis. Long-term use of antidepressants can lead to serotonin syndrome, a rare but serious condition. High prolactin levels from antipsychotics can result in infertility or breast enlargement in men. Medications can lead to chronic gastrointestinal issues like constipation or irritable bowel syndrome. Long-term weight gain increases the risk of obesity-related diseases. Antipsychotic-induced diabetes is often difficult to manage. Chronic medication use can lead to fatigue and reduced physical endurance. Some medications impair the body's ability to regulate temperature, increasing overheating risks. Long-term dependence on medications can lead to tolerance, requiring higher doses over time. Some drugs, like carbamazepine, increase the risk of vitamin deficiencies. Long-term use of sedatives can lead to chronic daytime drowsiness. Chronic use of bipolar medications can weaken heart function in vulnerable patients. Medications can increase triglyceride levels, contributing to cardiovascular issues. Repeated medication changes can lead to physiological instability. Some drugs have been linked to persistent gastrointestinal bleeding. High doses of lithium may cause vision problems like blurred or double vision. Prolonged medication use can lead to numbness or tingling in extremities. Many medications require lifetime monitoring, adding long-term medical costs. Long-term use of mood stabilizers may disrupt glucose metabolism. Some drugs can trigger persistent migraines. Chronic use of certain medications is linked to increased cancer risks. Mood stabilizers can suppress bone marrow production of red blood cells. Long-term medication use can cause dependency on sedatives for sleep. Chronic weight gain can worsen existing joint and back problems. Medications like Depakote can alter ammonia levels, potentially leading to encephalopathy. Prolonged medication use is associated with changes in white blood cell count. Antipsychotics may lead to the loss of fine motor skills. Certain medications cause chronic ringing in the ears, tinnitus. Many patients on long-term antipsychotics experience swallowing difficulties. Practical challenges and societal issues. The cost of lifelong medication is prohibitive for many patients. Insurance coverage may not fully cover all prescribed medications. Access to medications can be challenging in underserved areas. Frequent blood tests for medications like lithium are inconvenient and expensive. Some medications require dietary restrictions that are difficult to maintain. Finding the right medication often involves lengthy trial and error processes. Some medications are not covered by government healthcare programs. Patients often struggle to understand complex medication regimens. The stigma associated with taking psychiatric medication can cause social isolation. Many people face judgment for relying on medications instead of therapy. Side effects can interfere with the ability to maintain consistent employment. Side effects can interfere with the ability to maintain consistent employment. Medications can impair academic performance due to cognitive dulling. Frequent medication adjustments disrupt daily routines. Access to specialized psychiatric care is often limited. Medications can be difficult to store and transport safely. Patients may face judgment from friends or family who distrust psychiatric drugs. Dependence on medications can make travel or relocation stressful. Some medications are difficult to discontinue without professional supervision. Withdrawal symptoms can disrupt work and personal life. Many medications come with extensive lists of precautions, increasing anxiety about use. Medication shortages can interrupt treatment plans unexpectedly. Frequent changes in drug manufacturers can affect medication quality. Generic medications may not be as effective as brand name versions for some patients. Patients often feel overwhelmed by the complexity of managing side effects. Parents may struggle with the decision to medicate their bipolar children. Adolescents may face peer judgment for taking medications. Medications can interfere with athletic performance, limiting lifestyle choices. Workplace drug testing may reveal medication use, leading to discrimination. Societal stigma discourages open conversations about medication side effects. Some patients are pressured to stop medications by anti-psychiatry advocates. Difficulty adhering to medication regimens leads to inconsistent symptom control. Patients often report a lack of support from healthcare systems for managing side effects. Medications can limit participation in physical activities due to fatigue or weight gain. Side effects can lead to decreased social engagement and isolation. Some cultures view psychiatric medication use as shameful or weak. Lack of access to therapy alongside medication leads to incomplete treatment. Patients often feel frustrated by doctors prioritizing medication over other approaches. Bipolar medications may not address underlying trauma or environmental stressors. Patients may feel trapped by the need for lifelong medication. Societal misunderstandings about bipolar disorder create additional pressure on patients to prove their need for medication.